all about arthritis. I've tried to produce this to make it a simpler topic for medical students and residents. It's made unnecessarily complicated in textbooks by rheumatologists and medical scientists, but orthopedic surgeons deal with this every day, and they look at it in a far more simple and pragmatic way. Now, there's 5 basic types. There's osteoarthritis, where the joint is worn out, X-ray of the hip, loss of joint space, sclerosis, osteophytes. Inflammatory rheumatoid arthritis is an inflammatory process, here involving the hand, gross deformity, or the foot. It can also involve the spine, shoulders, elbow, hip, wrist, hand, hip, knee, foot, ankle. Septic arthritis. Remember my previous talk? Septic joint, painful. You've got to get it there to wash it out early to stop the destructive inflammatory process. But don't forget about Stafford and TB. Here it is in Crohn's disease. Hemorrhagic arthritis, bleeding in and around a joint. Bleeding disorders, haemophiliac, destruction from the inflammatory process. Neuropathic joint, also called Charcot's, seen in leprosy and more commonly in diabetes. There's a problem with the sensation from a joint, usually the foot, and abnormal loads placed across the joint leading to early and gross destruction. So the basic process is, as outlined here, an inflammatory process. Whatever the cause leads to destruction of ligaments, joint surfaces by the inflammation. Well, it might be caused by infection, blood, gouty crystals, or abnormal loads. Gout, look at nice crystals in the joint. Inflammatory process destroys the joint. Also remember pseudo-gout, similar process but slightly different crystals. Osteoarthritis, those other 5 types probably all eventually lead to osteoarthritis, although it's a little controversial. So osteoarthritis, primary or secondary. Osteoarthritis is simply a loss of the articular cartilage. You don't need big fancy definitions. Come into the operating room, see me do an arthroscopy, and I'll show you the loss of the articular cartilage to the bare bone. This is arthritis, secondary from abnormal cartilage, abnormal bone, abnormal loads. The X-ray changes have already been described. A knee replacement, when it's all is lost, joints destroyed, just replace it. The human body's just like a car. It breaks down or wears out, either fix it up or replace the worn out part. The more you drive it, the quicker it wears out. So here's a beautiful specimen. Abnormal cartilage, black pigmentation from these homogenetic acid crystals being deposited into the area. This condition called ochronosis alkaptonuria. It wears out too quickly. Can't take the loads. So abnormal cartilage, excessive loads, wears out, secondary OA. There's other causes. Death of the bone from radiation, testicular cancer, radiated testicles destroyed the bone, the scaffold, the cartilage collapses down. Or may collapse from a fractured neck of femur, sliding screw plate put in, the screw up the neck, destroyed the blood supply. The young man, 35, segmental AVN, destroyed the scaffold. The articular cartilage collapses down or swings around in the breeze and causes abnormal wear, early OA. Dermatomyositis, 43-year-old, unusual condition, leads to secondary OA, abnormal wear, secondary OA. Avascular necrosis, steroids or alcohol, common cause. Skin condition here, 42-year-old, native destruction of the bone. The joint surface collapses down, big flap, just swinging around here in the breeze. See, destruction of the joint, needed a hip replacement. Paget's disease, very common, need to know this. Abnormal formation of bone, probably a viral infection. Although it's excessive bone, it's weak bone. Leads to deformity, deformity of the femoral head, bone formation, the soleus. Deformity, abnormal loads or excessive loads across the joint, early destruction. Destruction of the hip joint, hip replacement required. OA, other causes, deformity of the joint, resulting from childhood causes. Slipped up a femoral epiphysis, the leg externally rotates, the head slips off the top of the neck. You have to put pin in to stop it from slipping further. It results of pistol grip, typical pistol grip deformity. Abnormal or excessive loads, early OA in their 30s. May need a hip replacement then, rather young. So the treatment is based on the cause. Osteoarthritis, weight loss, anti-inflammatories, walking aids, glucosamine may help in early stages, Synvisc may happen. May help, SYNVISC. In the later stage, you have to call in the orthopedic surgeon. They have all the fun then. They do a joint replacement. Maybe an arthritis in a younger patient, or osteotomy, which is cutting the bone, reshaping it to displace the loads. But they're not so successful. Hip replacement. Inflammatory arthritis. Get the rheumatologist in early. A lot of medication, quite dangerous, has to be monitored very carefully. Soft tissue surgery to deal with the ligament rupture tendon rupture, get them early repaired, prevent early deformity, so avoid excessive or abnormal loads. Then later, when it's all destroyed, calling the orthopedic surgeon, joint replacement, maybe a fusion. Tends to work well in inflammatory arthritis, actually, fusion. Septic joint destroyed, often young. See, young patients can't do joint replacements then. Got to work to preserve that joint. Wash it all out, right antibodies. Hemorrhagic, young patients, hemophiliacs, can't destroy the joint at too early a stage. Got to get in there. Wash it all out, control the abnormal bleeding, get the right blood products going to control and prevent further bleeding. Neuropathic joints, very, very challenging. Got to control the diabetes, treat the leprosy, get the right medication to avoid destruction of the joints. May have to do early fusion, at very later stage fusions or joint replacements are very hard in neuropathic joints. Small print for the gold medal winners in the class. Rheumatoid arthritis, that's really inflammatory arthritis in children. Can involve multiple joints, destruction, pain, deformity, a lot of problems for the child. Joint replacement not available, right medication, physical therapy. SLE involves multiple joints, again, as an JRA. Younger patients, 30s, 40s, got to get all the right medications going later, joint replacement. Psoriasis, about 5 to 10% of patients with psoriasis have joint replacement, have joint involvement, may need surgery. Crohn's, ulcerative colitis can also produce septic joints, as in the case I've just shown you, require early washout, right antibiotics, and may destroy the joint. Sickle cell, you've got to know about this in North America, don't you? It's abnormal hemoglobin, abnormal clumping of cells, early death of bone, loss of the scaffold, collapse of the articular cartilage. So you've got to treat it early to prevent destruction of joints. Now, to complement this talk, please have a look at my other talks, all about orthopedic infections, all about orthopedic pathology. So I hope that overview of arthritis is useful for you to go and do further reading and in your clinical work. Thanks for your interest.